kind of interesting as I've metaphorically become a stem cell myself, and I'm telling everybody about this, like the word of mouth thing. I think the demystifying of whatever anybody's hesitations are is really around the education.
Education is the biggest thing, so once you educate somebody on this new paradigm shift, it's eye-opening, it's life-changing.
I'm in my mid-40s, and I started playing the violin when I was 4 years old. So it's been over 40 years since that has been sort of my trade and where I've been trained. Starting around 12, I became a competitive softball player. So sports and athleticism and performance has basically been part of my life and my identity since I was a child. And then that sort of crosses over into my work now, which is as a corporate executive, music executive. Competition and performance and time management are all through lines with, that have been consistent my whole life. And they are also challenges because while I'm not physically exerting myself on a day-to-day in a corporate work environment, sitting in an office and going from meeting to meeting and, having direct reports and delegating work, there's still a mental toll it takes when I'm like, I have no time to rehabilitate like my injuries, like from decades, and the stress of that wears on you over time. So I have a fully torn rotator, and labral tear in my right shoulder. It's been for over 12 or 13 years. It's the combination of being an outfielder, being a violinist, powerlifting, whatever it is. And then 3 weeks before I saw you, I actually tore like my ACL and my MCL in my right knee, both right side injuries, doing Brazilian Jiu-Jitsu, which I am not good at. So, I should have maybe known better, but I just was able to add a shot. And, I think even my physical therapists at this point, like a couple months in, are like, wow, you're really making a lot of progress with this, and it's just getting better every day. And I'm pretty confident that I don't need surgery, and I don't want to get it, but I love that in your treatment protocol, like you encourage all of that, whether it's spinal decompression work, acupuncture, massage therapy, chiropractic, physical therapy. We got to do this stuff too, alongside the injections. I think once people experience this first on the physical level, it sort of travels upward and ascends to the mind and spirit, and the ripple effect of then running all these other things to then match your quality of life with how you feel just starts to happen. Whether it's like in home improvement or making different self-care decisions, because it's all now in service to like quality of life and how I certainly have felt from just, I got multiple injections. So I did pretty well there. When you talk about that, this kind of regenerative medicine and this therapy is not just for professional athletes, like that means something. And when I talk about it to coworkers and just friends and family, we're basically all normies, like that's what it is. It's like we're corporate workers, we work at nonprofits, we are musicians, and everybody needs it to prolong, what they love doing.
And that's true. There is no age limit in this. I've treated teenagers because they hurt themselves in high school sports, and I've treated people up into their 90s. So it is for everyone. And if you have an injury, you shouldn't wait. Don't make it worse, because, sometimes when you wait, you might end up in surgery, which is not what we want. But yeah, we want to continue to help people all over the world. And, we want to see and help change lives for as long as we can do this.